Hello students, good afternoon. This is Mrs. Singletary. I'm just logging in to post my audio micro lecture for you all. This week we are wrapping up week 4, and I was looking and it looks like we've got a lot going on here. I looked at the grade book and noticed that nobody has taken exam 1. It has been open since Monday. And I guess everybody's planning on taking it on the last day, and that's fine. It is it's only over exams 1 through 3, and I forgot to check how many questions there were. Let me see if it'll show me. It is proctored by Proctorio, so make sure you all review everything we've done. There's 80 questions. It's actually a pool of 155 questions, but you'll only get 80. We can do a quick preview here. I don't know if I've already done one with you all, but so you have an idea of what it's going to look like. It says, which of the following is an example of a private sector payer? And here is the answer, and it'll always give you feedback and tell you why that is the correct answer. Okay. Let's do this other one. Eligibility for government-sponsored plans where income is the criterion may change as quickly as daily, weekly, monthly, or yearly. So the answer is monthly. Okay, and it tells you here that government-sponsored plans where income is the criterion changes monthly. And it is in chapter 3. So this will give you an idea of what the exam questions are going to look like. It does give you, they're all multiple choice. And as long as you read the chapter, you reviewed the PowerPoints, you completed the homework for it, you should do okay. The other question was, name a benefit a provider usually gets from participation with a health plan. And the answer would be an increased number of patients. So obviously that would be the benefit. So I gave you all a preview. What is the formula for calculating an insurance company's payment in an indemnity plan? And the answer would be charge, deductible, coinsurance. This is the formula of how the clinics actually calculate, the insurance payment. So you have to first get the amount. Remember the cycle, the billing cycle? You end up with a charge, a total amount of the visit. Then you take away the deductible and the coinsurance, and then the remaining balance. So that is exam 1. So hopefully everybody gets a chance to complete it, because remember that exams are 40% of your grade. So we also had a discussion this week that I've only seen a few discussions posted. And the discussion here, it gives you questions. Everybody was supposed to click this, CPT for beginners. It's a really cool video. It's also a lecture, and the lady in the lecture takes you step by step of how CPT coding works. It's CPT coding for beginners. So there's several exercises, and there's questions here that have to be copied and pasted onto a discussion. All right, so hopefully you guys get a chance to do that. This is the video link where you can get the answers, but it also continues. It has a part 2. So if you guys get a chance, please watch part 2 of that as well. Oh, it looks like some students have already answered the questions to that. Good. I'm glad y'all are working on that. For chapter 4, for week 4, we had chapter 5 of our textbook, which was over, I think it was CPT, yeah, procedural coding, CPT, and HCPCS. And these, I've got some videos on here that are super helpful Make sure you guys are watching all of this, all of these that I provide here. We also had 3 Connect assignments this week and of course 1 exam. And so now we're moving on to week 5. It's going by really, really fast. So if you think about it, we've already completed chapter 1 on the introduction to the revenue cycle. Chapter 2 was on electronic health records. It was on HIPAA, sharing and protecting patients' health information, all that stuff. Chapter 3 was on patient encounters and billing information. Chapter 4 was on ICD-9, diagnostic coding. And week 4 was on chapter 5, procedural coding or CPT codes. Now we're moving on to week 5, where we covered 2 chapters. Chapter 6, this is on visit charges and compliant billing. And chapter 7, healthcare claim preparation and transmission. So once again, guys, there is a lot of information that needs to be covered, that needs to be reviewed. I love teaching this class online, but only when the students read the information and complete the assignments before the deadline. I know that, a lot of you work and you're taking other classes and stuff, but you don't want to fall behind on this class. For this week 5, there's also a lab assignment, a computer lab assignment on how to fill out the CMS 1500 form. So all of these videos I have here, guys, will help you. Because if you look down here, there's, like I said, a computer lab assignment on completing the CMS 1500 form. And you're going to upload it right in here. I think I have it set to upload. Let me just make sure. Yeah, you're gonna upload it here, and it's due February 16th. So please get it done before that. Like I said, all of these videos here show you how to complete it. There are some links that have the CMS 1500 form. Let me get to week 5. So see, you have these videos here. Here's the actual CMS 1500 form. I think this is the blank form. Yeah, you see, this is the one that we have in the book. And their instructions, I'm trying to see if I can find the video or the instructions for this assignment. Videos, CMS 1500. I'm trying to look for the video that tells you what it is you're going to write in there. I'll look for it. I'll look for it and let you guys know. But like this video right here on, what is a CMS 1500 form? Well, I thought it was here. Well, here's the form that I was telling y'all about, that it's here, it's blank, and it should allow you to save it and, type on it, or you could print it out and handwrite it as well. Let's see what this is. Okay, here's another blank one for you all to use. But the chapter actually takes you to each block, guys. The chapter will tell you, let me lower this. I'm going to lower that a little bit. But this is an excellent video, and this is what you're going to write. Your CMS 1500, you're going to write this information here. Please do not write your own information, guys. Okay? Does that make sense? So only students who watch and listen to the audio micro lecture are very familiar with the instructions that have to be written on the actual CMS 1500. Okay? I don't know if y'all can hear that video. Students usually can't hear. But this is the video that you're going to that you're going to use to complete the CMS 1500. All right, so you actually have to open the video and go through it as you're completing it. Okay, so the CMS 1500 that you upload, again, it's not to have your information, but this information here. Your CMS 1500 for full credit needs to be the name that's on this video. Reach out to me if you have any questions on how that needs to be done. But it's called How to Properly Fill Out a CMS 1500 Claim. All right, just follow the instructions on that video and it tells you exactly. Now, in your textbook, if you go to chapter 6, let me see. I'm looking at, I don't know if it's chapter 6 or chapter 7. It's actually chapter 7. It takes you through each step of what you're going to complete. So let me pull up the PowerPoint so you can know what I'm talking about. So chapter 7 is on healthcare claim preparation and transmission. Again, let's not lose focus on what we were talking about from the very beginning of the revenue cycle. Remember week 1, we started right in here on the preparation, the starting of the claims. Well, we've already discussed all this and now we're right here on preparing and transmitting the claims. Remember, we started with pre-registering the patients. Step 2 was establishing financial responsibility. Step 3, now that we know who's paying, if they have insurance or private pay, now we know we can check in the patients. And the patient's already in the room, so the doctor is completing the encounter form, circling all the codes that pertain that we can bill for that patient's visit. The patient's already done. They've had labs and EKGs and x-rays done and all that. Now the patient is right here in step 6, ready to check out and pay if they need to. So now the patient's gone, but their information now goes to the billing department where they're going to prepare to transmit a claim. All right, and that's what this chapter is about. That is what we're going to learn how the steps are. So in this chapter, you should be able to distinguish between an electronic claim transaction and a paper claim form. Although there's very few clinics that still do paper form, I'm sure there's still some. The majority of the healthcare facilities do submit claims electronically. And I'll show you exactly what that CMS 1500 forms look like. We're in this chapter, you're going to discuss the content of the physician or the supplier information. You're going to explain the hierarchy of data elements. Remember the HIPAA 837 claim? You're going to categorize data elements into 5 sections and evaluate the importance of checking claims prior to submission. Because you're going to learn that there's a few little cues that it gives you when filling out the claim form. Like, for example, one very important piece of information that I learned when I was learning how to complete these is that even though you're entering the information, you never include decimal points or commas. That is one thing I clearly remember because I used to get them when they would review my CMS 1500s at the clinic. They would always correct me on you cannot use any periods. Like right here, it says 7.1. If you were going to put 7.1, you would get your claim rejected. Isn't that crazy? So you would just put 7, maybe a space and a 1. That's it. So this is an example of what a CMS 1500 claim form looks like. They're all look the same. Some might have the red lettering, but overall, a CMS 1500 claim form all looks the same. And so the chapter is going to take you step by step on, if you look at the claim form here, like there's a number 1 there, number 2, I can't see this, I need my glasses. Number 1 here, it's asking, does the patient have Medicare, Medicaid, TRICARE, Chap, a group health insurance plan, or other, which means they're going to pay cash or whatever other type of insurance they have. Line number 2, you're going to write the patient's name. What patient's name are you going to write for the exercise this week? Remember, you got to go back and watch the video. Remember the video we were watching a few minutes ago? This one? So this is the patient's name that you're going to include on your CMS 1500. The patient is Jane Doe, Jane K. Doe. But check out who the insured is. It looks like the insured is her husband, right? So be very careful when completing those claim forms, at least the one you're going to turn in for a grade. So it says the items in the patient information, they identify the patient, they identify the insured, whoever the patient has insurance with, whatever the health plan is, the benefits. So if you look at it, when you're completing these and you're reading chapter 7, you're going to go to, let's say, line 8. So I want you to go to your ebook or your book and go to line 8 and see what it says about line 8. Line 8 says reserved for NUCC. And it tells you there in the chapter what NUCC is and what the patient status is. If I'm not mistaken, that's usually left blank. I just use the number as an example. But you're going to come here and go to patient line 1A, insured's ID number. The video tells you what the ID number is. The video tells you who the insured is, who the insured's address is. So all of this needs to be completed as you're watching and listening to the video, okay? And then it goes through the rest of the form. It even tells you what goes here on the side, what goes on this little square right here. I think it's 33. It tells you everything that you need to write there, okay? So you can't really submit the CMS 1500 form until you watch the video that I mentioned. And, you know, the rest of the chapter just kind of tells you where everything goes, what exactly it is. And, you know, very, very important that you cannot be missing, you know, some of the common errors that are found in a claim that are mainly rejected for are missing or incomplete service facility information. Or maybe the patient has Medicare, an assigned indicator, and you forgot to include it. Missing part or referring provider information. Maybe you forgot to include the patient's date of birth. These are all reasons for having a healthcare claim rejected. And you know what that means? If a healthcare claim is rejected, then doctor doesn't get paid, right? They won't get their payment. So that's chapter 7. I want you guys to take a little bit of time on going through that because you'll have to complete the CMS 1500 and upload it. And I think I showed you all where that needs to be. So chapter 7. So you're going to watch all these videos. Here is the blank CMS 1500 form for you to use. And you're going to watch all these videos because the video is where you're going to get the information for the CMS 1500. Okay. So I hope that makes sense to you all. There's also going to be connect assignments on chapter 6. That's what I started to open a few minutes ago. Chapter 6 is on visit charges and compliant billing. Again, every chapter will start with the revenue cycle because it's all affected. But chapter 6 mainly talks about the use of modifiers, how to prevent from having a CMS 1500 rejected, because once again, when it gets rejected, the clinic will not get paid. So please go through both of these, having to do with payments, how we're going to code and bill and things like that. Okay, that's what I have for week 5, guys. I hope you guys have a great week. Please reach out to me. I will continue to submit early alerts, Eagle alerts. So if HCC counseling gets a hold of you, please respond to them and let them know, answer them, because many times they can give you ideas on how you're going to study, how you're going to, they can help you deal with, how to pass and how to get the assignments done. They're there to help you. So if you fall below a 75, you probably will get sent to early alert, and counseling will try to get a hold of you. But they're only there to help you out, guys. They're not there to get after you or get mad at you, nothing like that. Okay? I hope you guys have a great week. Please reach out to me if you have any questions, and please get your assignments done before the deadline. All right? Y'all have a great week. You take care. Bye-bye.